everyone. Come on in. We are All Things Odd, and we have a new episode today. I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I'm Whitney Hodges.
All right. So today we are going to be talking about something that's happening in this month. But before we get there, I'm going to have Hannah or Dr. Galloway talk about our YouTube channel.
Yes, so this is our YouTube channel. You can see we're getting new subscribers all the time. So if you want to send our videos to somebody, this is a good way to do it if they don't have social media. We also have like fun thumbnail images here so that you can see what the video is about. And you can subscribe so then you'll know when we have new episodes.
Yeah. Here's some of the fun ones. I like that one. How flexible is your audiologist? So I had to put that one up. So thank you guys for sharing that out for us and inviting people to join in to watch. So today we are actually going to talk about National Speech and Hearing Month. So before it used to be Better Hearing and Speech Month. So I had to kind of catch myself a little bit here because I wanted to make sure that we said it right. So May has always kind of been designated as this Better Hearing and Speech Month, but it was kind of dating back to 1972. But as of July of last year, the National Association for Hearing and Speech Action, which I believe you can say NASA maybe, or NASA, announced that in 2024, they were going to change the name to be the National, technically it's the National Speech Language Hearing Month. We kind of just shortened it a little bit to National Speech and Hearing Month. So that's what May is. So we decided to kind of talk about some topics. Today, we're going to be talking about a certain topic just to kind of get the awareness out.
So during this month, professionals spend time educating the public about human communication and what we can do to prevent and address communication disorders. The U.S. Congress, the White House, state governments, the National Institutes of Health, and the CDC, and a bunch of other organizations recognize and promote the observance of National Speech and Hearing in the month of May.
And not to toot our own horns, but a few years ago, we did get a proclamation issued for the city of Fort Collins that May is Better Speech and Hearing Month. It was when we were at our previous office, but now they've actually changed it. So I guess it's not, since it's not Better Speech and Hearing Month, maybe we need to reapproach for next year to change it to Speech and Hearing Month. So since the pandemic, more children are manifesting communication delays, which probably doesn't surprise a lot of people, knowing that we weren't in groups as much as we were, even small kids, people having their mouths covered with masks, that was tough. The World Health Organization is warning about hearing loss from loud noise exposure. And the aging U.S. population is also expected to experience communication challenges. And so we know the baby boomers are getting older. So we kind of have a lot of different things going on at once as far as generational concerns for hearing.
Yeah. So with National Speech and Hearing Month, we're going to turn it in and look at audiology because that is our industry here and discuss some facts and information from an audiologist point of view. So first fact is kind of interesting, but did you know that 2.5 billion people are projected to have some degree of hearing loss by 2050, and over 1 billion young adults are at risk of permanent and even avoidable hearing loss. So that's like being exposed to noise, or when you're driving your car down the street and you hear somebody with a big loud bass, or if you're in different environments. Like I go to a lot of basketball games and they have like a decibel meter, and I literally stand there going, oh my gosh, I literally want to just pass out my card as people exit the building. So there are avoidable hearing losses, but over 1 billion young adults are at risk for this more permanent. So it's not just a temporary one where you go home and you feel like your hearing's dampened, but the next morning it kind of feels a little bit better and you can hear better. But this is actually permanent loss that can be avoided if we continue to take the time to educate people about what they can do, right, to prevent hearing loss. So many people struggle to hear, but I think that a lot of the times people don't know where to start. So that's what we kind of wanted to talk about today, is trying to help people do the first question of, okay, I think I might have a hearing loss, but where do I start? And I'm going to have Dr. Galloway kind of talk a little bit more about the symptoms. So we'll kind of get into the question that we're going to pose today and see. And again, guys, like, we're live, and the only reason why we do it live is so that way people can comment or make comments, ask us questions, ask other people who are tuning in questions. So feel free to put it in the comments, something that you're thinking about, and we can see what you're saying, and then maybe we can kind of address it.
Yeah, so times when it might be appropriate to see an audiologist. I will say if you've never seen an audiologist, then it's an appropriate time to see one. Everybody needs a baseline hearing assessment to kind of know where they're at. When you were in school, if you went to public school, they did do some like regular hearing screenings throughout your K through 12. But if you haven't had a hearing test since then, likely it's changed. And also those are just kind of a screening and just, seeing kind of the bare minimum. So what brings people in a lot of times, if it's not, they're not concerned about hearing loss, sometimes people will come in for dizziness, tinnitus, sound sensitivity. Sometimes people will come in describing like eustachian tube issues, popping in their ears or cracking or something like that. I think those are probably the big ones that bring people in that aren't hearing loss, maybe ear pain or pressure in your ears. Another one is auditory processing disorder. A lot of times people don't have the name for that, but they say, I hear what people are saying, but I don't understand, the bigger picture, or I don't understand, what's exactly being said. And so that can also kind of be something that we can work up. But even if you don't have hearing loss, it's good to have a baseline hearing assessment to say, okay, when you were X amount of years old, this is what your hearing looked like. So that if you do come back in 10 years or 20 years and you're having an issue, we have something to go back on and say, okay, when you were in your 30s or your 40s, this is kind of where we were. Many times patients don't come in until, they're having a lot of problems, and then we don't know how long it's been there. We just have less information about it.
Yeah.
I think Dr. Phillips now is going to be pulling up a website resource for our national organization. That's the American Academy of Audiology, or AAA. And here you can see some great information about what an audiologist is, how we become audiologists, types of services, like Dr. Galloway talked about.
Yeah, I'm going to play this video. Hopefully you guys can hear this, because I think it's kind of interesting and it gives you information. This is just right on our national organization site, our website. And I think it's a really good and fun video. So I'm going to play this real quick.
Why see an audiologist? Because we can help you stay connected to the people you care about.
Because you feel like those around you are mumbling or not speaking clearly, I can help.
Because of persistent ringing or buzzing in your ears, I can help.
Because you're feeling lightheaded or unsteady or have a spinning sensation, I can help.
Because your baby did not pass their hearing test and needs a follow-up, I can help.
Because you want to protect your hearing at work, concerts, and sporting events, I can help.
Because you've heard that hearing loss is connected to cognitive health, I can help.
Because you want to hear your grandchild's laughter, your spouse's voice, your favorite song. Because you want to dance with confidence and play catch in the backyard for many years to come.
Because we can help.
Audiologists evaluate, diagnose, treat, and manage hearing and balance disorders in individuals of all ages, from infants, children, and teens to adults and mature adults. Find an audiologist in your area and learn more about how we can help.
Yeah, so I love that video because it kind of tells you what we do, right? And I think it's kind of interesting because I wanted to kind of go round robin too, and kind of see what people, like if you were asked the question, like, what do you do? When people say, oh, I'm an audiologist, like, what do I do? And so, I love that video because it kind of broke it down a little bit of the symptoms that you might be experiencing when to actually go see an audiologist. And that's what we're talking about here. So I kind of wanted to go round robin and see, like, if you were asked the question, you just introduced yourself and somebody said, oh, you're an audiologist? Like, what is that? What do you do? So we'll start with Whitney and then we'll go up to Dr. Galloway and then back over to me.
Well, usually if they kind of know what it is, they like to say, huh, what, just to be funny. But I like to tell them that I like giving people back their sense of communication and helping them reconnect with their family members. A lot of patients we see, that's what they're lacking. They're talking about not being able to communicate with their grandchildren or not being able to appreciate sounds that they used to be able to listen to, things that they maybe took for granted. So being able to assist in providing them some of their communication and their sound back.
Yeah, I love it.
So I usually say I'm an audiologist, and then I say a hearing doctor, after I say that, because a lot of times people, you can tell they don't know, but they don't really know what to ask. Like if you just say audiologist, they don't really know what to do next. So I usually say I'm a hearing doctor. I work with cochlear implants and hearing aids, adults and kids. I thought that video was kind of cool too, because it was showing all the different kind of specialties. They were talking about, if you're dizzy, I can help. If your child failed their hearing screening, I can help. So I thought that was kind of cool too.
Yeah. I have to say, early on in my career, I said I would bullet point things that we would do. Oh, I could check your hearing. We fit hearing aids. I could do balance testing. Tinnitus is something that I love to do and just kind of bullet point it for people. And then I was like, people don't even really care or know. I like that video too, because it definitely was like, if you're experiencing this, I can help, right? You don't have to go into, okay, this is the technology that we use and this is what we can do for you and da 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 da. But now I've kind of stepped back a little bit, kind of like Whitney, and say something different. And I say, I'm a connector. I connect people back to their lives and to their loved ones. And really that's what it is. And so I have a couple of challenges here for you today. I mean, our show is going to be a little bit shorter, but here's the challenges. Number one, if you're an audiologist or a hearing professional and you have a way of saying like what we do, put it in the comments. Like, I want to hear, like, share it with other people, maybe even students that are coming out of school or audiologists that are seasoned. It's a nice way of learning how to introduce ourselves a little bit differently. But I want to ask you guys to put it in the comments of how do you introduce yourself as an audiologist and help each other out. And so that's kind of how I would love for people who are watching this in our different groups that we've dropped this show in to kind of share with other colleagues how they introduce themselves. So that's one action item. The other thing is if you are knowing that you have a hearing loss, like, schedule that appointment now. And it's not just a hearing loss, but you heard maybe it's a kid that has a problem. Maybe it is you're dizzy, right? Or maybe you have some ringing in your ears or whatever it is. Then schedule that appointment and start off with an audiologist, because again, with this National Hearing and Speech Month, this is what we're doing, is we're trying to take the time to pause what we're doing, seeing patients, and educate people a little bit more and help the awareness of what an audiologist is. What do we do as an audiologist? So if you have any suggestions, any questions, put it in the comments. We can always come back. We are going live on Facebook, YouTube, on my LinkedIn profile, and also Twitter. And then we will drop it into Instagram as well. So on any one of those platforms, you guys can share it out, or you can put in the comments either how you introduce yourself if you're a professional, or maybe something that you've learned from an audiologist if you're a consumer or somebody that has a hearing loss or balance issue. Final words from anybody else?
Nope.
All right. So
the website you gave, the American Academy of Audiology, there is all kinds of good resources for all things audiology on there. So I think that would be a good resource for anybody that wants to kind of know more.
Awesome. Well, we will be back next week. We'll probably have another topic just to kind of pause and continue with National Speech and Hearing Month as well. And again, send us any ideas that you want us to cover, and we will see you next week. Thanks, guys.
Bye. Thank you.